Welcome to Team 7's case presentation, which is about DT and his issues with his eye drops. We hope you enjoy. Today, our reason for encounter is that DT requires a replacement for his natural tears eye drops. In our subjective background, we have it noted that DT is a 22-year-old male that states he keeps his eye drops with him while he works as a car mechanic. He states that he uses his left hand to open his eyelid and squeezes the bottle with his right hand. He puts 4 drops into both eyes in succession. He describes how tears stream down his cheeks after use, as if he was thinking about his family. He then uses his shirt to wipe away those tears, which again reminds him of his family. DT states that the drops result in relief for a few hours, after which he administers more eye drops. DT also discloses that he does not have any medication allergies and that he takes no other medication. DT also communicates a desire for acne medication to treat his latest acne outbreak, as he always wants to look his best for his family.
DT has no known drug allergies and also no known drug intolerances. In our objective background, we see that DT's eye drop container appears black and greasy, but otherwise there are no known laboratory values.
Medication list. DT is taking natural tears eye drops. The strength is unknown. He is taking this for dry eyes. He takes it as follows. Instill 4 drops into both eyes as needed for dry eyes. DT says he uses this medication every few hours when he notices his eyes are dry. We do not know what day he started this medication.
The first indication we have for DT is dry eyes. The drug therapy problem involved with the dry eyes is convenience. Adherence is the real drug problem here. DT is experiencing dry eyes because he is improperly using his natural tear eye drops. We have 2 goals of therapy for DT. The short term is to reduce occurrence of dry eyes from every few hours to twice daily in 2 weeks. The long-term goal of therapy is to maintain reduction of dry eye occurrence from every few hours to twice daily indefinitely.
The second indication for DT is his acne. We categorize the drug therapy problem and indication as needs additional drug therapy. DT needs additional drug therapy to treat his current facial acne outbreak. In our goals of therapy, we included 1 short-term and 1 long-term goal of therapy. For our short-term goal of therapy, we want to reduce DT's facial acne in 2 weeks. For our long-term goal of therapy, we want to eliminate DT's facial acne in 4 weeks and prevent it from recurring indefinitely.
So for therapeutic alternatives, we have chosen natural tears eye drops, the same eye drops. The strength is unknown. We change the directions to instill 1 drop into each eye. Close eyes and place fingers on corner of eyes near the nose and hold for 1 minute. Wait 5 minutes and repeat 1 dose for a total of 2 drops per eye. Use every 4 hours as needed. We have also chosen benzoyl peroxide 2.5% gel. Directions are to wash the face thoroughly with cool water. Apply a small amount of gel to acne spots on face once daily. May increase to twice daily if needed. Another alternative is salicylic acid 2% solution. The directions are to apply to the affected area once daily in the morning.
For the new medication list and rationale, the first medication, the indication is dry eyes, and we're keeping him on the natural tears eye drops with the unknown strength. We're going to have him instill 1 drop into each eye, close eyes and place finger on the corner of the eyes near the nose and hold for 1 minute, and then wait 5 minutes and repeat for a total of 2 drops per eye every 4 hours as he needs it for his dry eyes. We changed DT's dosage instructions because of the way he was using the medication previously was incorrect, and not holding his eye near the nose with the finger might not allow him to get the correct dosage of the drug. Also, not waiting in between drops at least a couple minutes, so we're going to say 5. He wasn't getting enough active ingredient, so he was using it incorrectly. With the new directions of use for him, this product should be more effective in treating his dry eye symptoms. In terms of his acne that he's worried about, we're going to start him on benzoyl peroxide 2.5% gel. We're going to have him wash his face thoroughly with cool water first, then apply a small amount of gel to the acne spots on his face once daily, and he may increase it twice daily if needed. We initiate this medication for his treatment of acne because it has a strong antibacterial activity, and 2.5% gel is the lowest strength to start with, just to see if it works for him. It's able to break down keratin, and therefore it is effective in unclogging his pores from the grease buildup at work.
Follow-up evaluation. Follow up with DT in person in 2 weeks to assess the safety and effectiveness of Natural Tears eye drop for DT's dry eyes and benzoyl peroxide 2.5% gel for DT's acne. For Natural Tears eye drop, we will monitor for the effectiveness of the drug therapy by asking DT about any changes in the duration of relief of eye dryness and the extent of relief experienced after each eye drop. We will also observe for eye redness or visible dryness, which may indicate a lack of effectiveness. For safety, we will monitor it by asking about any symptoms of allergic reaction after each eye drop use, including skin rash, respiratory difficulty, and swelling around the eye. For benzoyl peroxide 2.5% gel, we will monitor for effectiveness of the drug therapy by examining the reduction of DT's facial acne. For safety, we will monitor for adverse drug reactions such as contact dermatitis, erythema, and hypersensitivity reactions.
And to make sure that DT uses his new products effectively, we'll want to make sure that we go through a few counseling points with him. The first one being that you want to wash your hands thoroughly with soap and water before using any eye drops to make sure that any particulate matter from your hand is off so that it can't get into your eye. Then you want to place the index finger on your lower eyelid and draw it down. This will expose a little groove called the conjunctival sac, and you place 1 drop into that little sac, and then you want to close your eyes immediately. You do not want to blink because blinking can cause the medication to leave your eye. And then you will apply pressure to the inner corner of your eye near the nose. This prevents drainage so the medication can take its full effect on your eye. If you're doing multiple drops, you want to wait at least 5 minutes between putting a drop into the same eye. Then also with the benzoyl peroxide for the acne, it's important to know that it can get worse before it gets better, so you expect to see an improvement in a couple weeks, not just a couple days.
Questions that we would ask DT during counseling. How long have you experienced dry eyes? What product have you tried for your dry eyes? When do you experience dry eyes? Is it only when you're working or outside of work too? Regarding his acne, how severe is your current state of acne outbreak? When did your acne start? And what made your acne worse?
Here are the references that were used in the making of this presentation. And here are the real references that were used in the making of this presentation. Thank you so much for watching. I truly hope you enjoyed.